The human spine consists of 33 bony vertebrae: 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. When viewed laterally, these regions have 4 distinct curvatures: a cervical lordosis, a thoracic kyphosis, a lumbar lordosis, and a sacral kyphosis. The cervical, thoracic, and lumbar vertebrae are unfused and are known as true vertebrae. They are separated by intervertebral discs and connected by a network of ligaments. They become progressively larger from superior to inferior. The remaining 9 vertebrae, in other words, the sacral and coccygeal vertebrae, are fused and are known as false vertebrae. They progressively become smaller from superior to inferior. The fused sacral vertebrae collectively form the sacrum, while the fused coccygeal vertebrae collectively form the coccyx. The function of the vertebral column is to provide structural support to the head, neck, and trunk. It also helps to maintain posture and allows for triaxial motion. It's capable of flexion, extension, lateral flexion, and rotation movements. Its primary function, though, is to protect the spinal cord, which extends from the midbrain caudally to the level of the second lumbar vertebra and then continues as the cauda equina. The spinal cord possesses 3 main tracts: the posterior columns, the corticospinal tract, and the spinothalamic tract, although these won't be covered in detail in this lecture. Rather, the focus of this lecture series will be on the osseous, articular, and muscular structures of the spine. Each section of the spine will be discussed separately, but first I'll provide an overview of the structural characteristics of the spine and its main muscle groups. The anterior wall of the vertebral canal is formed by the continuous weight-bearing column of vertebral bodies and intervertebral discs. The lateral and posterior walls are formed by the pedicles, laminae, facets, and spinous processes, which together form a series of vertebral arches. The intervertebral foramina are openings in the lateral wall. This is where the spinal nerves exit the vertebral canal. The vertebral bodies are stabilized by the anterior and posterior longitudinal ligaments. The posterior column is stabilized by the nuchal ligament complex, which contains the supraspinous, interspinous, and infraspinous ligaments, the capsular ligaments, and the ligamentum flavum. Disruption of these ligaments can result in instability of the spine. A typical vertebra, represented by L2, is presented on screen. Functional components include the vertebral body, a vertebral arch, and 7 processes: 3 for muscle attachment and leverage, and 4 that participate in synovial joints with adjacent vertebrae. Intervertebral discs lie within the fibrocartilaginous joints which sit between adjacent vertebral bodies. They increase the length of the spinal column by about 25% and consist of an inner nucleus pulposus and an outer annulus fibrosus. The nucleus pulposus allows for a limited range of movement between vertebrae, but also acts as a shock absorber. The annulus fibrosus connects adjacent vertebral bodies and confers stability to the vertebral column. Adjacent vertebrae are also linked together via the articular facets on their articular processes, which form the facet joints. The facet joints are true synovial joints and are comprised of the posterior articulations of the vertebrae. Finally, the intervertebral foramen, the passage for the spinal nerves and their accompanying blood vessels, is formed by the superior and inferior notches of adjacent vertebrae and the intervertebral disc. Next, I'll briefly outline the muscles of the back, which move the vertebral column, pectoral girdle, and arm, and help to maintain body posture. These muscles can be arbitrarily divided into intrinsic and extrinsic groups. The intrinsic muscles lie deep to the thoracolumbar fascia, while the extrinsic muscles lie superficial to it. The intrinsic muscles are further subdivided into 3 distinct layers: a superficial layer, which consists of the spinotransversales muscles, an intermediate layer, which consists of the erector spinae muscles, and a deep layer, which consists of the transversospinal, interspinales, and intertransversori muscles. All of these are in some way involved in movement of the head, neck, and trunk. The superficial layer of muscles, the spinotransversales or spinotransverse muscles, are involved in movements of the head and neck. They include splenius capitis and splenius colli. They're known as spinotransversales because they originate from spinous processes and insert onto transverse processes of vertebrae. The intermediate layer of muscles, the erector spinae or sacrospinalis muscles, are involved in movements of the head, neck, and trunk and consist of three vertically oriented muscles that lie parallel to the vertebral column. From medial to lateral, these muscles are the spinalis, longissimus, and iliocostalis. This group is known as erector spinae because they are responsible for straightening the vertebral column. Finally, we have the deep layer or intrinsic back muscles, which consist of transversospinal, interspinalis, and intertransversi muscles, all of which are involved in movements of the neck and trunk. The transversospinal or transversospinalis muscles originate from transverse processes and insert onto spinous processes of vertebrae. In other words, the opposite orientation of the spinotransversales muscles I had mentioned before, and consist of three individual muscles. From superficial to deep, these are the semispinalis, multifidus, and rotators. The interspinalis muscles, which include the colli, thoracis, and lumborum subgroups, originate from and insert onto the spinous processes of adjacent vertebrae. And the intertransversi originate from and insert onto transverse processes of adjacent vertebrae and are divided into three parts, including the intertransversi colli, the superior portion, intertransversi thoracis, the middle portion, and intertransversi lumborum, the inferior portion. So that's the group of intrinsic muscles of the back, which are summarized on screen. Next, the group of extrinsic muscles of the back. This group lies superficial to the thoracolumbar fascia and is involved in movements of the pectoral girdle, arm, and ribs. They include trapezius, latissimus dorsi, rhomboid major, rhomboid minor, levator scapulae, serratus posterior superior, and serratus posterior inferior. These have been covered in a separate lecture on the shoulder complex, a link for which is available on screen. So that's an overview of spinal anatomy. In the next video, I'll discuss some of the unique anatomical features and muscle groups in each of the regions of the spine, starting with the cervical spine.